Welcome to The Explainer. Today, we're diving into a massive, frankly sneaky health threat that might actually be ticking away right now inside you or maybe someone you love. We're going to demystify a condition known as atrial fibrillation, which is commonly just called AFib.
Just to wrap our heads around the sheer scale of this problem, over 1 million people in Japan alone are currently living with this condition. So we're not talking about some rare anomaly here. It's a widespread reality that's impacting lives on a massive scale every single day.
Okay, let's dive into this. The quote you're seeing really hits the nail on the head. What makes that million-plus figure so terrifying is exactly this. The most dangerous state is having absolutely no symptoms at all. This is what we call hidden AFib. We're dealing with a silent thief. It's a condition that essentially acts as a ticking time bomb, operating entirely under the radar without setting off a single physical alarm.
Section 1. The silent heart threat. Let's look at the actual mechanics of AFib.
And this brilliantly illustrates what's going on under the hood. A normal, healthy heart beats a steady 60 to 100 times a minute. It uses this beautifully precise 0.2-second relay between the upper chambers, the atria, and the lower chambers, the ventricles. It's like a perfectly timed biological clock. But with AFib, that precision completely vanishes. Instead of a strong rhythmic pump, those upper chambers just quiver. They tremble chaotically. And this forces the lower chambers into this erratic, disorganized movement. The heart's electrical system is basically short-circuiting.
Now, some folks actually do feel this chaos. The potential warning signs can include sudden palpitations, that really uncomfortable fluttering feeling in your chest. You might also notice general chest discomfort, maybe getting short of breath when you're just doing basic stuff, unexpected fatigue, or even sudden spells of dizziness and lightheadedness. But remember our silent thief. A huge number of people feel absolutely nothing. And the really scary part? The absence of those physical symptoms definitely does not mean you're safe.
Moving on to Section 2, how the disease progresses. The escalation of AFib.
So this escalation happens in 3 distinct phases. It's not a static condition, it aggressively worsens over time. It starts with paroxysmal AFib. Think of these as intermittent attacks. Your pulse might seem totally normal most of the time, but then suddenly out of nowhere, the rhythm misfires. If that's left unchecked, it bumps up to step 2, persistent AFib. Here, the attack doesn't just stop, it becomes continuous for over a week, and this is where that heavy, noticeable fatigue really sets in. Finally, it becomes permanent. The quivering literally never stops. The silent thief has slowly taken up permanent residence in the heart.
Section 3. 3 deadly complications. The real danger of this silent thief.
Look, AFib isn't just a quirky little heartbeat. It's secretly setting the stage for 3 catastrophic events. The first deadly complication is heart failure. Because the heart is moving so rapidly and erratically, the atria literally exhaust themselves. The heart's primary job as a pump starts to fail, so blood begins to pool and stagnate. This leads to swelling, totally unexplained weight gain, and severe shortness of breath. If you find yourself suddenly struggling on a normal flight of stairs, getting incredibly winded during a casual round of golf, or, worst case, unable to breathe when you lie down at night, you need immediate emergency room attention. Thankfully, medical professionals can check for this really quickly using a BNP test, which is just a simple blood test that looks for specific heart distress markers.
Now, what's really interesting about this slide is you can use it to map out the second major complication, stroke. See, when the atria are just quivering instead of pumping, blood pools, and that's when it forms clots. Those clots can travel straight up to the brain and block an artery. In this scenario, time is literally brain. Doctors use this CHADS-2 stroke risk score to measure that exact danger. So things like age, high blood pressure, diabetes, and heart failure, they each add 1 point to your risk profile. A prior stroke, that adds 2 points. This quick calculation tells doctors right away if a patient urgently needs blood-thinning medication to stop a clot from forming in the first place.
The third complication? Honestly, there's no way to sugarcoat it. It's shocking. Dementia. Look at that chart. Cognitive decline happens 5 times faster in AFib patients compared to just normal aging. Why is that? Well, it's because unstable blood flow and tiny microclots are constantly bombarding the brain, slowly starving it of oxygen over time. It basically hits the fast-forward button on a natural process, turning it into a rapid, devastating decline. So we're left looking at a disease that causes heart failure, massive strokes, and rapid cognitive decline, yet it often hides completely undetected. This brings us to a huge cliffhanger. How in the world do you find a disease with literally 0 symptoms?
Which brings us to Section 4, Catching Hidden AFib Early, the tools to fight back.
Fortunately, we have some incredible tools to expose this silent thief before the irreversible damage is done. In a clinic, doctors use an ECG, an electrocardiogram. Now, a standard clinical ECG is incredibly detailed. It looks for a jittery baseline and irregular QRS waves, those familiar sharp spikes you see on heart monitors and medical shows, to map the heart's electrical currents. But there's a pretty big flaw. It only captures what's happening right that very second. If you have those intermittent paroxysmal attacks we talked about, and they aren't happening the exact minute you're sitting in the clinic, the standard ECG misses it completely. Plus, let's be real, asymptomatic people rarely visit the doctor anyway. To counter this, doctors use a Holter monitor. You wear this continuously for 24 hours, sometimes up to 2 weeks. It's specifically designed to catch those hidden, fleeting attacks while you just go about your normal life.
But you know what? You don't even need to wait for a doctor's appointment to protect yourself. The everyday tech that actually saves lives is so accessible right now. The absolute best tool is completely free, manual pulse checking at home. Just feel your wrist, check for a steady, rhythmic beat. The second tool is probably already sitting in your bathroom cabinet, a standard blood pressure monitor. Many modern ones actually pop up with an irregular heartbeat alert right on the screen. And finally, smartwatches. Devices like the Apple Watch have highly advanced ECG features built right in. This is a real game changer. Consumer tech is acting as a personal 24/7 early alarm system, and it is frequently catching AFib right in the nick of time.
The silent thief is terrifying, absolutely. But here's the thing, it has a fatal weakness. It is entirely vulnerable to a simple pulse check. We have the technology and we have the knowledge to strip away its secrecy. So the question I want to leave you with right now is this. Will you take just a few seconds to check your pulse, or maybe check your parents' pulse, today?